beautiful people, and welcome back to my YouTube channel. My name is Sandra and this is Beyond Techsolutely, a place for understanding tech and creating exciting narratives around it. If this is your first time, welcome, and do not forget to share, like, and subscribe. So on today's video, I'm going to be talking to you about different digital applications in the health sector in Zimbabwe. If this is something that you'd want to watch, stay tuned. So obviously, with the whole digital transformation, the medical space in Zimbabwe has not been spared. I attended the ZIMA medical symposium that was held at the Celebration Center, and I went there just to try to understand different digital platforms that were being introduced that are in use in Zimbabwe. And it was actually a very interesting expo. Should I call it an expo or a learning curve? Technology is the way of life and is actually changing the way the medical and the healthcare sector is in. We see things like in the AR, the VR, the artificial intelligence, sensors, medical, data-driven solutions, analytics on certain things that we can actually use, and Zimbabwe is not spared. I am very interested to show you that we actually have upcoming applications in Zimbabwe, and I did interview each one of the solutions that came and attended to the ZIMA medical symposium, and we spoke in length about how their technology solutions are helping into the healthcare sector. So come with me as I show you around. Health at home, doctor at your doorstep.
Hi, my name is Mona Lisa and I am from Health at Home, which is a doctor at your doorstep. Now what we do is we have an app on Google Play and iOS where you can just log in and you can book for a general practitioner or a specialist to come and see you at your home. It's in the comfort of your home, and our tagline is a doctor at your doorstep. So we have everything from a general practitioner to gynecologist, psychiatrist, psychologist, even nurse aides who can come and see you at home. You can also, if you don't have data for the app, you can also just go onto our website or hit us up on our WhatsApp number and someone will assist you and just take you through the entire process of booking a doctor.
Okay, so how long will it take for a doctor to come to your doorstep?
Within the hour.
So
because if you book in the morning and you say I want the doctor to come at 11:30, that's when the doctor will come. If you say I need a doctor just now, depending on the area, we'll just choose the nearest doctor to you, and that's the person who will come.
Okay, and what if it's after hours?
If it's after hours, our normal working hours are 8 a.m. to 8 p.m. And if it's after hours, of course, it might take a little bit longer and it might cost a bit more because it's after hours, but the doctor will still come.
Oh, so there is a cost to...
There is a cost to the after hours aspect because, most people would have gone home and the doctors might not be there anymore. But yeah, we will get the doctor to you, but just like an extra cost. Yeah.
Okay, and with the costing, is it relatively cheaper than going to the brick and mortar clinic, or it's because of convenience?
The convenience, so that it's slightly more than a walk-in consultation, but at the same time it's convenience. The doctor's coming to you, there's no waiting rooms, there's no forms to sign, there's no getting shouted at by but yeah, so all of our doctors are trained with etiquette and time management. They're very professional. You can literally go onto our website and see all the types of doctors, and you can click who you like.
Okay,
Yeah.
that's nice. I like the whole initiative.
Thank you.
Especially the whole COVID and waiting room, and then sometimes you're
Yes.
sick.
Sometimes you're sick. Sometimes it's not. You don't need an ER.
Yes,
You know, sometimes you just
definitely.
need a checkup. Sometimes you need just to have your blood test taken, and to maybe take hours and hours and hours. But what we've actually done is we've partnered with key strategic partnerships, like MedOrange, Lancet, MIC, Diagnopath, UBC, etc. So let's say the doctor comes and decides, no, you need medication. MedOrange will deliver, so you don't have to step outside your house.
Nice.
MedOrange will deliver. We have a chest X-ray machine from MIC that can actually come and do an X-ray at your house. Again, no need to leave the house. Your blood samples will be taken in by the doctor, results delivered to your doorstep. So everything, literally, you don't need to get out of bed if you're that sick.
Except for if you have a toothache, right?
Except for when you have a toothache. We're actually trying to work on getting a dentist who's bringing in a mobile machine. So hopefully before the end of the year, a dentist can also come through and just see you at the house.
And what about ultrasound for pregnant women?
Not yet.
Can you consider that? Because
We'll consider that. We'll take that because I know our gynae gets a lot of those requests. You know, they're like,
Exactly.
okay, gynae, can you do the ultrasound at my house? But those are huge, cumbersome machines. So we're trying to look for like a mobile one. But once that's there, definitely you see the update on the app.
Okay, thank you so much.
No, thank you.
So please
Don't
visit.
forget Health at Home. It's on Facebook, Instagram, everywhere. Just go Health at Home and you'll find us and book a visit. You don't really need to get into the car. Fuel is $2. We'll come to you.
Yes, we love the innovation. Thank you so much.
You're welcome.
And what is the cost? Sorry, if you're...
It depends whether you're seeing a specialist or a GP or you just want
let's
an
say a
S8.
GP.
So a GP's consultation is about 80.
Okay.
Yes.
And you take medical aid?
Not yet. We're actually in the middle of getting our application in with AFAS. So once they give us a go, it's a go. Because it's a new idea. So they actually have to sit down, committee after committee, and see if it works and how all of that done, and actual scientists. So it's been kind of a process. We applied in December. So we are hoping that this quarter's meeting gives us good results and we can start taking medical aid. But those with international medical aids, it works.
Okay.
Yeah.
Thank you so much for
You're
your
welcome.
time.
Thank you so much.
And it's Health at Home.
Health at Home, a doctor at your doorstep.
Okay. Thank you.
This is the New Health 263 stand. We are an IT company that specializes in IT software development. All right.
Okay.
So we have two major services that we offer. We have a claim switching platform and a practice management system for doctors' rooms. And our number one product or service is the claim switching platform. So basically, what the system does, it allows healthcare service providers, your pharmacies, doctors, clinics to submit the medical aid claim forms electronically, online, and in real time.
Okay.
So people no longer need to fill in the manual claim
Exactly.
forms.
And send it to the doctor.
Exactly, it's all done online in a matter of 5 minutes. But a response is returned within 5 seconds, letting you know how much the medical aid is going to process or pay the service provider for the claim. So what we use to verify or to authenticate the claim is a fingerprint reader. So the patient's fingerprints have to be enrolled onto the system, and they can always use their fingers to verify their membership and for them to sign their claim form.
Yes, I've used this a lot of times.
Alright, so basically that's where that's coming from. Then the practice management system, it's just like any other practice management system. However, we are trying to also synchronize patient information. So it just keeps track of the patient demographics, your general details, and all your history within the doctor's room. So they no longer need to give you a small booklet where you keep all the doctor's notes from one doctor to another. You just go to your doctor's room, enter your name, and the information populate. So that is only currently functional to the doctors that have our system at the moment. And we do have just a few doctors on the platform, but we're hoping to grow that service as well as big as the claims switching platform.
Okay, so my question is, on this record, say I go to a dentist and I go to probably another specialist and then another GP, maybe I use 2 GPs, would that information be synchronized? Can this other GP see my other medical history?
We are hoping that it will get to a point where it's synchronized, but of course we will put in authentication which will allow you, the patient, to give the doctor's consent to see your previous records from previous other doctors. Yes.
Okay. All right. So thank you so much. I love the way that you've presented the whole manual process, from the claims, the authentication, because I understand a lot of people were using other people's medical aids in hospitals.
Yes, that's true. So the fingerprints, since fingerprints are unique, then there's no way anyone else can tamper with the other person's medical aid, of course, unless there is concern given between the two parties who are sharing cards. We do know that it's still possible that I could take my mom, for example. I take my mom on my medical aid card and I'll be signing, but my mom is receiving treatment, or there's really nothing we can do in cases of where that happens. And it also means the doctor would have been involved in that whole transaction, but we have tried to minimize all medical card fraud.
Yes, I think Health 360 has done strides. I've read about it because, like I said, I'm into IT, so I want to know who are the giants in the market, and I found out you guys have a very great system. It's good that it's locally developed, it's a local product, and I think you guys are doing well. So if there are any people who would want to use the platform, right, where would they visit your website? How would you come up across?
All right. So we do have our website where they will see our contact numbers. Currently still being developed. We are making a few changes, but immediately when you open on the website, there are contact numbers to people who you can call, and they'll be able to assist you. However, we also have our offices in Borodo along the road, Matsatsa Office Park. They can visit us at any time. They'll just say they want to go to New Health 263, and we'll be ready to help them. Then most of the services that our service providers, we've connected our biometric readers as our contact numbers. So in case they can't get to our offices or unable to reach our website, when they come across a reader, they can take down our contact numbers and get in touch with us.
Okay, thank you. And with the data that you collect from people, is there any room for having like futuristic analytics on knowing what services needs to be like expanded? Like if you see a lot of people are claiming in the GP, probably in the maternity ward, are you going to be able to say, okay, we have 30% of women who try to queue up, because you know definitely that these people have scanned and then they get help? Are you able to give insights on knowing with the data that you have been collecting to better improve Zimbabwe in the medical space?
We do hopefully want to get to a stage where we'll be able to data mine everything that we have collected so far, but currently nothing yet has been made, has been established as that is in concern. But we have looked at that as maybe our next step in the industry, whereby we can be able to provide that information, be it to pharmacies or doctors, or even, when we want to get statistics on which diseases are being prevalent within the country and so forth. So it is something that we have noted down to look into, although we don't have anything that has been substantiated at the moment.
All right. Thank you so much, Health 263, for your platform. Thank you.
All right.
So my mission is to spread the knowledge I have in the healthcare sector, because there is no joy in being sick and being stuck and not knowing what to do next. I've actually joined the loyalty program at MedOrange pharmacies, as you can see. And with this, I can get a free makeover when on a good day, and then allows me to get discounts when I shop online and in store. I actually also have a virtual loyalty card on my account that I created with MedOrange pharmacies, and I am able to get anything that I want, especially repeat medicines that I would want to be delivered, they actually have a logistics company that can send them directly to me. So when I was there, I was hoping to see certain things like a 3D printing, you know, probably the certain technology that can help you print your skin, your pills, biotissues, you know, and probably robotics into the health sector. But I mean, I think where we are currently is totally different from where we have been a few years ago. So obviously we're going to evolve. We had not seen certain things like this. Just to tell you a story why I was so interested about this platform. 4 years ago, my uncle was diagnosed with colon cancer, and the only oncology centers were in Harare. So he had to come and get treatment. And me, I had to help assist him with all the treatment that he needed to be done. So he's a civil servant and he used the Christmas medical aid like any other civil servant, right? So there wasn't any health 263 back then. So what would then happen was we would go for a hospital visit, and the doctor would then write, you need to do a list of tests like UATs, what, you know, and then you will then have to find certain places where you can do the test. So normally we'll start with the PSMS clinics, and then they would normally say, okay, we can do these tests, but these tests we don't specialize in it, so we have to find another place to do them, like another laboratory. So when you go to that laboratory, they will then you know, write a quotation to say these tests would cost you, let's say, $3,000. Is your medical aid going to pay? So because there wasn't any health 263 that would then have this connection, would have to physically go back to the PSMI office, then say, wait up in a queue because it's always packed. Oh my God, it was always packed during that time. So you would go there, then they would look at the quotation, they'll say, oh, this is too expensive, you can only pay this amount. Okay, this will pay. They'll write a note saying you would make a payment by this day for this amount. So you have to go back and then book an appointment. Okay, they can pay this. If there's any shortfalls, you then pay. If there's no shortfalls, you have to pay. So imagine the type of chemo that he was doing was after every 3 weeks, and after every 3 weeks I had to have like 6-7 quotations I'm taking back for them to check if they can make a payment, and then go back with that. And I like the whole idea that the health 263 came up with a system that just makes everything easy. You can just use your fingerprint at any hospital, wherever medical space that you're in, so that they can just change all this. Like, it's so stressful. Imagine you're sick and you have to do this by yourself, going to every pharmacy and everything. Oh yeah, and on the pharmacy part, he used to take this medicine, a chemo medicine. It was very scarce. Like, you have to find it in different medicines, but then you have to make a call, do you have it in stock? And then sometimes you have to wait for the doctor to tell you, we have changed the dosages now, 500 whatever. Like, I mean, it's all medical terms, so I'm just gonna say it in normal languages. But then using this MIS platform, obviously at the comfort of my home, I can just, you know, check if I want to have this, and then they can tell me where to get several medicines. That is something that I've experienced. So it actually is something that I would actually use. And using the MedOrange e-commerce platform, because he would have certain meds that he would take, because he did his chemo for 12 cycles. There's certain meds that he would take at any given point, repeat orders. The Med Lemon actually helps with the whole repeat orders. So at any given point, I'm making a payment for that, it gets delivered. I wish I had that platform then 4 years ago, because I had to experience the hardcore manual way of how the medical systems were, and I really appreciate the whole digitalization that they've actually done. And talking about the medicines at home, the doctor at your doorstep, I really wish our oncologists would just come, because there's certain times when he would feel pain and then you have to call them, and sometimes you get there and then they start consultations at 2 p.m. and then sometimes the doctor is stuck at another hospital, you have to come back the next day. Like, it was a lot that was going on, and I really appreciate this whole introduction of these platforms. I know there are a lot of other platforms. I know they're going to have a lot of different rollouts to certain things, and they will be really helpful for the medical space. So I really enjoy. I'm a proud member of the MedOrange family, and from now probably I'll be getting my cosmetics and my meds from MedOrange in the comfort of my house. Oh yeah, going back to the Health 263, where there's the automated claim form. Okay, so there were times when you would have to make a payment to certain things. Like I said, my uncle had colon cancer, so you normally go for colonoscopy. So sometimes we book for a colonoscopy surgery, and the price will be higher, or they'll say we want cash at this moment, we're not taking my medical aid card. So you can then do a claim form. So I think after the first time, I had no idea that you're supposed to submit the form within a specific time, because I mean, this person is doing a colonoscopy. After that, there's a lot that was going on. You have to do the back and forth. So it just slipped my mind. So when I submitted, they told me that I was actually late to submit the claim form. But with the Health 263 platform, it's very automated. It's in real time. You can submit your claim form. You just have to fill up the form, then just talk about wherever the doctor, all the information that you need, and then submit your claim form, and then your money will be reimbursed to you. So these innovations actually work with whatever that I went through, and I was looking at it in a way where health and technology could actually be at a better place, and I think this application did justice. If there is any other applications that you know, that you have used, that you think we can introduce, link them down below and we can talk about the different things. As for me, make sure to sign up for your loyalty card with MedOrange pharmacies, and until next time, have a great day. Bye.